Pain when urinating, causes and symptoms. Dysuria is the pain and burning that is produced when you urinate. It almost always means that you have a urinary tract infection. It could have many different causes, and in some cases, it may cause you to urinate more frequently. This is a very common illness that more often affects young women who are sexually active. It can also affect pregnant women, people with diabetes, and those who have any other type of bladder problem. These urinary tract infections are less frequent in men. When they experience pain while urinating, it can be caused by urethritis or other illnesses related to the prostate. What are the symptoms? The symptoms that pain when urinating produces tend to be very different between women and men, but both may experience a strong burning or stinging when they start to urinate, or, a lot of the time, the discomfort is felt when they are done urinating. If you feel pain when you begin to urinate, this means that there is a urinary tract infection. On the other hand, if you feel pain when you finish urinating, it can be a very serious bladder or prostate problem. For some women, the pain they can feel may be internal and caused by a urinary tract infection. But in other cases, it is external and caused by inflammation or irritation of the skin. What are the causes? An infection in the urethra, bladder, or kidneys is one of the most common causes of experiencing dysuria or pain when urinating. The most common type of infection is acute cystitis, which is a bladder infection, or pyelonephritis, which is a kidney infection. It can also be caused by some sexually transmitted diseases. Other possible causes. Trauma. This can be caused by a local lesion or irritation due to the insertion of a catheter or sexual contact. Anatomical obstructions or deformities. Lesions. They can happen if you have had a lesion on the outside of your genitals. External irritation. It is basically caused by vaginal douches that are done too often or from using some kind of product. Hormonal effects. Neurological diseases. Kidney, bladder, vaginal, or vulvar cancer. Conditions that affect the immune system. Kidney or bladder stones. Sexually transmitted diseases. Some medications, like those used for cancer treatment. Unfortunately, these products cause side effects like bladder irritation, obviously. Kidney, vaginal, or yeast infections. How is it detected? The doctor will review the medical history of the patient and will ask some questions on how frequently they urinate, as well as finding out if they have experienced these symptoms any other times. They may do an abdominal examination, as well as one of the external genitals. Women require a gynecological exam. The doctor will also request a urine sample, which will be sent to the laboratory to be examined under a microscope. They will be able to verify the presence of blood or not. They will then proceed with the culture of the urine sample to see if bacteria are growing in order to confirm if there is a bacterial infection and identify the bacteria that are causing the infection. Dysuria treatment. The most recommended treatment is done with antibiotics, but it is important to know the causes that have caused this infection beforehand. In any of these cases, they suggest drinking a lot of water so that you can greatly reduce the discomfort that pain while urinating causes.